Acute pancreatitis is a dynamic inflammatory condition with variable severity and outcomes. Accurate severity classification is critical to guide management and predict prognosis. The revised Atlanta classification, introduced in 2012, standardizes severity assessment. It classifies acute pancreatitis into mild, moderately severe, and severe categories. The classification is based on organ failure and local or systemic complications. Organ failure is objectively defined using the modified Marshall scoring system. This scoring system evaluates respiratory, cardiovascular, and renal function. A score of 2 or more in any system defines organ failure. Mild acute pancreatitis is defined by absence of organ failure and no complications. These patients typically have a self-limiting disease course. Moderately severe acute pancreatitis includes transient organ failure lasting less than 48 hours. It may also include local or systemic complications without persistent organ failure. Severe acute pancreatitis is defined by persistent organ failure lasting more than 48 hours. This category carries the highest morbidity and mortality risk. The modified Marshall score evaluates cardiovascular function using systolic blood pressure. A systolic blood pressure less than 90 millimeters of mercury unresponsive to fluid scores 2. Respiratory function is assessed using the ratio of arterial oxygen pressure to fraction of inspired oxygen. A ratio of less than 300 corresponds to a score of 2. Renal function is evaluated using serum creatinine levels. A creatinine level greater than or equal to 19 milligrams per deciliter indicates a score of 2. Equivalent thresholds include approximately 170 micromoles per liter. Local complications are categorized based on fluid collections and necrosis. Acute parapancreatic fluid collections occur early without a defined wall. Pseudocysts are encapsulated fluid collections that develop later. Acute necrotic collections contain both fluid and necrotic tissue. Walled-off necrosis represents mature encapsulated necrotic collections. Systemic complications include exacerbation of pre-existing comorbidities. The revised Atlanta classification improves upon the 1992 system. It emphasizes the persistence of organ failure rather than just its presence. It also refines definitions of pancreatic and parapancreatic collections. Clinical takeaway is to assess organ failure duration and complications to accurately classify severity in acute pancreatitis.